I'm Ben Phipps. I'm a sports medicine physician at Ortho Montana. I'm originally from Minnesota. I'm a farm boy from Minnesota. Did the family medicine residency program in Billings and sports medicine fellowship through the residency program, and in combination with Florida State University and several other locations. Came here after a sports medicine fellowship and residency. What's not to like about Montana? I like the outdoors. I did a lot of my schooling in Duluth, which up in northern Minnesota on Lake Superior, which I actually think is kind of a Midwest microcosm of the Rocky Mountains. You know, we had the trout rivers and the endless backpacking trails and all the camping and kind of backwoods sort of experience without having mountain peaks to take advantage of. And so my draw to Montana is the lifestyle. I like a hardworking, attitude. Blue collar I think is important, and I think it makes for a good personality and general attitude in the state. And motivated patients, which is also nice. And then the availability to recreate is everything myself and my family is after, from spending time in the mountains, skiing in the winter, or ice fishing in the winter, to backpacking and hunting and fishing in the summer, and just getting outside and enjoying something active and healthy and outdoors. You can't beat Montana for that. As soon as I had to get up on Christmas morning at 4 o'clock to milk cows, I decided to look outside of dairy farming. Medicine followed shortly thereafter. Junior high school, I knew I wanted to do medicine. I've always been intrigued by the injuries I sustained and yet was still able to recover from. And just the human body, I think, is an amazing organism, and its ability to cope and heal is just an incredible thing. And so I've always been in awe of that. And between my desire to chase down sports and be around athletics and kids and young, healthy people in general, it was a pretty easy thing to decide. I did a lot of sports. I've always been very active. Probably most successful in marathon type running and distance stuff, but I did 3 sports through high school and, competed in college at various levels. I think the sports and athletic population in general it's a different mindset, and so I think there is an important piece to being able to relate to not just the physician taking care of you, but anybody involved in getting you where you want to be as an athlete from an outcome standpoint with your goals, and then obviously if you are injured or have any hurdles or things that hold you back, I think anybody involved in that care needs to understand, that there's more motivation behind you as an athlete to get back to your sport, and not to just get back, but to get back to the same level or a higher level than you were at, is critical. There's lots of ways to deal with problems, but athletes tend to be on a little shorter timeline. They've got different urgency to them, and what may not be a priority to the general public can be a huge issue for them. And so I think absolutely it helps to relate. I take care of everybody from not quite the cradle to the grave, but we start taking care of kids when they're 6, 5, 4, all the way up to 80s and 90-year-olds on a regular basis. So I appreciate the interaction with people, and I specifically like dealing with kids and high school age group. I enjoy their attitude, their perspective. I enjoy their competitive fire and their ability to heal. And I think they have a little bit different sense of humor, and things are just different in life at that age. Whether it's at the training room or at a sporting event or here in the office. But I like people in general. It's part of the reason I do what I do.